Hi, all. I apologize. I was away from my computer. I could hear you all talking, but
we'll give everyone another minute.
Good afternoon, everyone.
Hello. All right. I think I have the recording on. Yes. Okay. All right, we're going to go ahead and get started. My name is Dr. Chelsea. I serve as the program manager for Region 10 Gateway to the Rockies Opioid Council, also referred to as the GROC. We have the executive committee meeting today, so we are going to do a little bit of attendance, just to see who is in the room, have some general updates, and then we will jump into the RFA revise and resubmit discussions. Those handouts were linked in an email to the executive committee. Commissioner Del Kemper is here. George.
Hello.
And Sandy. Oh, she said she was going to be a little late. Mayor Bud.
There I am. I'm here. Hello. Good afternoon.
Okay. Hello. Dr. Ryan.
Yeah, I'm here.
All right. And then Elisa, she might be in the meeting with Sandy, not here. And then anyone else in the room just for attendance purposes?
Erica Haig's here, just to listen in today. Thanks.
Hi all, Rosie Glazer here from the Stedman Group.
And
Eric Butler from Jefferson County.
JK from the Stedman Group. I'm just here for the first half hour. Really, if there are any questions around Medicaid or reimbursement or anything, I have some special knowledge and I can answer this for the first half hour.
Jean Biondi, Jefferson County.
Amber Dower, Jefferson County.
And I saw Sean come in.
Yeah, hi, this is Sean Henley with Red Rock Recovery Center.
All right, I will go ahead and go into updates. We'll give Sandy and Elisa a few minutes. So just a reminder that all applicants will receive a status letter and an Excel export of their scorecards, if applicable, at the end of June or early July. So we did incorporate that feedback mechanism in this round of funding. The review committee will receive a satisfaction survey around that same time. I'm still planning to give the committee off in July, which has been a continuous request. It's on my mind. It's looking like it's going to happen. But I still want to host that meeting and dedicate it to the advisory board, have them review the revised application materials from the satisfaction survey that was given to applicants after they submitted. And then the review committee satisfaction survey, make sure I incorporate all that feedback. I'm also planning to do a focus group in early July with applicants to talk about the full spectrum of the process. Again, try to incorporate things into the SOP and future RFA rounds. Again, have the advisory committee review that, so make some SOP revisions, and then take that to the council in August. So it's a very thorough and comprehensive integration of changes. Disclosing scorecards at this stage of the evaluation process may undermine the objectivity and fairness of the evaluation process. So the purpose of that is really to keep evaluation on the merit of applications opposed to some type of comparison ranking. It's also intended to reduce bias, increase rigor and integrity of the process, keep the review committee focused on the goal. I can always discuss broader themes of all 47 applications. I can speak to the bell curve of applications, the landscapes of proposals without discussing individual applications. So if you have questions on any of that, feel free to reach out at any time. As a reminder, we received 47 new applications for funding, requesting just over $38 million. So it's a relatively competitive opportunity. There's a 30% chance of funding. Applicants should expect partial funding awards. We had 4 capital-based applications. That means that the entire project was rooted around a capital purchase. We had an additional 6 applications have capital components that the committee can choose not to fund or partially fund, and the project can still be carried out. We received 8 applications for prevention, 13 for treatment, 15 for recovery, 4 for harm reduction, and 5 for planning and coordination. And then I give you the dollar amounts associated with each funding category. So how we're going to do the revise and resubmit discussion is it's going to be a 15-minute time frame. I'm going to aim for about 5 minutes of going over the revise and resubmit request from the applicant. Then we'll open the floor for 8 minutes for general discussion, and I've buffered in 2 minutes for that voting. Remember, voting to advance now is not a final commitment of funding. I do encourage you to review all of the application materials over the next several weeks. All applications advanced from group discussion or R&R will go through a final review on June 23rd. I've scheduled June 23rd to be solely a budget day. So if you have questions about partial funding, conditional funding, please make sure you voice them at this time. Amber is going to be keeping track of that so that we can create some different types of Excel spreadsheets to give you visuals of how budgets are going to play out and fit into different funding categories. Voting to not advance now is not a final denial of an application. And then again, on June 23rd, you can always motion to partially fund or conditionally fund. Any questions around this so far?
Yeah, I had one. If voting to not advance now is not a final denial, what is it? Like what will happen to an application that we vote not to advance?
Ideally, it would not be pulled up. Like that is, the application's dead at that point. But no decisions are final until June 23rd.
Okay, so basically the broader GROC could say, actually, no, we are going to continue to consider this.
Yeah.
Yep.
And that's pretty standard in all major grant funding, is that even if you don't advance, it's not officially considered a denial until the award announcements are made. Great question though. Anything else? All right, so we're going to start with Monarch Recovery, and it does look like Elisa and Michael Miller joined us. Did we ever get Sandy in the room?
I don't
Sandy
see
did.
Sandy.
She texted me to say she is stuck in Highway 6. So she might
I knew
be.
she was going to be a little bit late.
Should we move forward and then we can bring Sandy up to date when she's able to join us?
Yep, I was just going to ask the chairs what they wanted to do. All right, so as a reminder, let me get my timer started. So the Monarch launch program for women is asking for $1,224,000 to purchase a home. The program aims to expand sober living specifically for women, providing a supportive environment for recovery. The project will focus on property procurement and enhancement, establishing a scholarship process, and optimizing Medicaid billing. The initiative addresses the unique needs of women in recovery, ensuring they have access to safe, supportive housing while promoting long-term sustainability. So she has, I'm not going to read all of this to you. You all had this document. Self-pay participants. So they range from anywhere from $1,000 to $1,500 a month, depending on bed size and location. The Monarch Launch Program offers a more affordable option at $200 per month. Currently, Monarch serves 73 clients across the program. 39 are self-pay. 16 initially received Signal-funded scholarships and transitioned to self-pay after obtaining employment. 25 funded by Signal Behavioral Health, 7 sponsored by Hornbuckle, 1 recipient of a Way Out scholarship, and 1 funded through Bridges of Colorado. Billing to providers and funding sources, Signal and Fines program are the 2 primary. They also use Medicaid, covering services such as substance use recovery groups, life skills groups, urinalysis testing, one-on-one peer support, psychiatric services, and case management. Claims are submitted weekly with reimbursement typically occurring on a bi-weekly basis. And then she has how they pay out for the other systems. Clarify demographics of participants, including percentage of people from various counties represented. Data was pulled from the last 3 years of their program. They had 1,467 clients. 1,133 or 77% had a no known address. 13% from Jefferson County, 10% from outside counties or outside states. And then Gilpin and Clear Creek, there was no recorded participation. They served 320 clients through transitional housing programs. There were some stats on justice involved, co-occurring mental health, pregnant or parenting, low income, racial ethnic minorities. And then how would they reallocate dollars? So she did include a spreadsheet. This is a breakdown of all of the operational costs right here. And so typically people would pay $1,200 for the program. But if we purchased the house, they would only have to pay $609 for the program. So they would that's broken up into two categories. Some of that is programming fees, and then the other half of that is your rental or your lease agreement. So by not having to pay rent or lease, they're only having to pay for their programming fees. And then I am going to yield the floor, so I will give 9 minutes on the clock.
You know, I remember one of the issues that we had with this, or one of the key questions that came up among the review team, was the separation between the scholarships and then the cost of the actual housing and how those two pieces fit together. And it seems to me, and I'd love to hear from, well, actually, Sandy's not on, but would love to, I think overall, it seems to me that they fleshed out those different costs that we needed more details about. And I think that's great. I won't reiterate the other reasons I was in favor of moving this one forward, but curious to know if others feel that kind of the key questions that came up were responded to well in this R&R.
Hi, everyone. This is John. Chelsea, maybe it's apparent. I'm still trying to look at the numbers. I haven't seen them in advance. Would the $1.2 million purchase the home outright?
Yes.
Okay. And it sounds like, and so there would be no mortgage or anything like that.
Right.
Right. And they're currently, it's the existing home that they're using already, and they're currently leasing it.
Correct.
Has, in their application or elsewhere, has there been any discussion about how GROC, if it supported it, you know, this award, would, what it would do to protect its interests? In other words, through recording of some kind of note or deed of trust or something like that on the property, or would it just be a contractual agreement?
We have not talked about that yet.
Is there one last question, and apologize? Is there any explanation in the application as to the what the annual lease cost is currently, and how that compares to the application amount?
Let me check. So I think this is on page 10 of the narrative. It's $386,000 a year.
Okay, thank you.
I can get that information to you after the meeting.
Sure. I'll see the floor. I will just say that it came up in connection with our prior round of applications, where a capital investment is requested. I do think, you know, it's important to think about how to protect it. In this case, you know, we would be purchasing the property outright. So it would be, you know, GROC's consideration as to how, you know, one alternative would be to retain some ownership in the property. A second would be to place some kind of a lien on the property itself that, you know, would evaporate if the commitment to using the property for the intended purpose was satisfied. So I think these are all things to consider at some point, whether it's today or back with the full council, I don't know, but I just wanted to raise those.
George.
Thank you. I'm curious, would this reduced price also be applicable to people who are receiving Medicaid funding, et cetera? Like, are we helping Medicaid save money in addition to helping people save money out of pocket? Because I think that would be something we would want. We don't need to have GROC dollars spend Medicaid dollars.
We can definitely place that stipulation on criteria of who would get placed into this house.
Okay.
Versus a different house.
And JK, you raised your hand right as I was saying that. Do you have anything?
Yeah, so Medicaid is great. Like it definitely helps fund their overall program, but their program is not this program, right? This is buying a house. Medicaid doesn't pay for any of that, period. Ever. It doesn't pay for rent, it doesn't pay for buying a house. It pays for those services that they mentioned and I think elucidated very well in their revise and resubmit, but that's for their services. So like Medicaid and this application are essentially separate things. They use Medicaid for their counselors, drug tests, things like that. They may take that and pay for their lease. I'm sure they do with that money, but it's not like nothing you would put in here on capital would displace Medicaid. So that's one really nice thing is that it's like bifurcated. Like they're just asking for capital and Medicaid never pays for capital.
Yeah, thank you. And I because dollars are fungible and because they're saying they're going to use these dollars to reduce the monthly cost, I'm curious if that would result in a lower monthly bill going to Medicaid.
No. Wouldn't change their Medicaid. Like they would still. I mean, that's good, right? It's like we want them to maximize their Medicaid billing because that's sustainability, that's income. But
Precisely.
nothing here is duplicating that. So like whatever you give them will not reduce their Medicaid billing, won't reduce their income from Medicaid. No.
Okay. And then I presume that we could, ask for them to guarantee those discounts. By the way, $1.2 million divided by $600 is 2,000. So, 2,000 people over a pretty long period of time could receive savings. I think, and so that's just one observation. I'm a little bit more right now in a mood of wanting to do the partial option, but I do support advancing this.
John, did you have any comments on if we did the down payment and closing costs versus buying the house outright?
So if we only paid for the down payment, then presumably they would be taking out a mortgage, which would mean a senior lender, which does introduce additional risk that if in the event of non-payment of the mortgage, the lender could foreclose on the property, and the building would then be foreclosed upon and would presumably not be used for this purpose. So there's that legal risk there. Obviously, there's certainly financially, it would be a lot less money, and we could still protect against that risk. So I would say from a legal perspective, I think we could do it either way. It's just a different set of risks. So I would say the council, could support either without my objection. Sure.
Do we need a motion from the group, or are folks ready? What do we need to do in terms of just determining whether we want to move it forward at this point?
Yeah, so that would be a motion to advance or a motion not to advance.
I'll go ahead and make a motion to advance this proposal from Monarch.
Who was the second?
Was George?
George, and then we will vote by opposition in the chat. So far we have only Elisa opposing. That means that we have a majority advancing the application.
Can you hear me?
Yes.
Mhm.
Did you have something to say?
Bud, we heard you a second ago and then we lost you.
Hello?
Hi.
Hello?
Are you opposing?
Hello?
I don't, Bud, we can hear you.
Can you hear me? I can't
Yes.
anybody there, and I don't know whether you can hear me or not.
Is anybody?
I would be more
have a
comfortable
phone number?
on this. Would there be no reason? Would there be a reason for? Oh, hello?
I'm going to text Bud and let him know we can hear him.
Leslie, can you hear me?
Oh, good, good. Yes, we can hear
Yeah.
you, Bud. We heard, I think most of what you were trying to say, but not the key point. We're just hearing silence now, Bud, just in case you can still hear us.
I wanted not just pay for the lodging for the people, get into a capital call on this project. We just paid the rent. Paid the housing for the people that are occupying the home. Okay.
And Bud, you're suggesting just pay the rent or the scholarships of the people attending, but not make the capital purchase of the home?
Hello?
We heard your hello.
On another.
I heard his question loud and clear. What I'm unclear on is what his vote is.
Yeah.
Well, I think, yeah, and I think what I heard, I see Elisa said that would be my choice as well. I mean, what I would like to clarify with Bud is he recommending that instead of allowing funding to purchase the home, that instead we simply cover the rent, and I would assume I don't know if that includes the cost of scholarships. Okay.
Yes, I'm going to defer to John on contracting that.
We can certainly contract that. In fact, that would be probably more consistent with what the normal contract would do, in that we would, likely on a reimbursement basis, pay them as residents joined and signed up and paid their lease. So it would be sort of an ongoing cost with a much lower initial upfront payment. And so it would also, more directly connect the funding to the benefit here, since we would be directly paying for that lease cost. I can't speak from the perspective of the applicant. I would think that buying the building, as opposed to continuing to lease the building, would have a very different impact on them financially. But I haven't seen financials see how that would work and whether there would be a savings, for purchasing the building outright. But we could certainly contract it.
I'm not sure I completely understand Elisa's comment on allowing more people to be able to use the program because the beds would still be used in a 7-month cycle. It would just change the risk to the council.
And just to confirm, Bud texted and said that what I had said a little earlier is correct. Cover the rent in lieu of capital investment. And he's working to get on another computer.
Okay, so we are at time. This is definitely an option. It sounds like for June 23rd. And I can work with the applicant to get some financials ahead of time for Jean so that we can be prepared for what that looks like. But there does need to be a motion of, do we want to continue this conversation on June 23rd, or are we completely done with this applicant?
So let me just clarify, we have a motion on the table. We had a second from George. We asked for anyone in opposition. Elisa did note in the chat that she had opposition, and then Bud has a different path forward. So that's two. I can, two that would be opposed to moving it forward. But I think what I'm hearing you say, and John, check me on this, that we can move it forward as is, but we would want a second motion to say we want to be able to open, and I'm very much in favor of this, to open up that conversation related to Bud's comment. Is that accurate?
Everything except, I don't think we need a motion to have Bud's observation make it into the mix.
Okay, so we're okay. I just want to make sure that Bud's and Elisa's concerns would then be factored in to our next conversation, which is what you are proposing, correct, Chelsea?
Yeah.
Okay, great. I would support that 100%. And then getting more information to help us determine what makes sense per your comment a second ago.
Yeah. So
okay.
It looks like we do have enough people to move that this application is going to move forward to June 23rd. Knowing that the committee has on the table to just pay the rent, not actually buy the capital. I'll work with the applicant to get those financials ahead of time, so that we can be prepared to continue this conversation for that funding option on June 23rd.
And Chelsea, given that as an option, one, purchasing obviously is in perpetuity, it would be theirs, and renting, do we have a timeline on that? A year, 2 years, 20 years? Two very different things.
Yeah, I believe in her application, she gave us she would commit to using the beds for 5 years, specifically for sober living. So we can use that same time marker.
I think it's going to take a lot longer than 5 years to give 2,000 people a $600 discount.
Okay, I'll work on some budget options with the applicant so that we can bring that to the table, and I'll notify the council when I get that dropped in the Google Drive so that you guys can review that.
This is Bud. Can you hear me any better now?
Yes.
Okay, I can hear. I got to a different computer. Thank you. It sounds like you got most of my message. I also didn't understand why when they did all the numbers they had, they aggregated all of the patients that they were caring for in their whole system instead of these 11.
Because the R&R specifically requested operational costs.
Oh, so operational costs across their whole universe of the clients.
Yeah.
Do we do that for most outfits?
No, we just asked that of them.
Okay. It would seem to be more beneficial if we were looking at just one property and one program, that we would survey them at this program at that location.
Yeah, so but I'm going to work with the applicant to get some of those budgetary numbers, and what the budget would look like if we just paid rent over time, how many years, what that would look like. And then I will deliver that budget into the Google Drive. I'll notify you when it's there. And that is a possible funding option that can be discussed on June 23rd.
Thank you.
Yeah. All right, we are moving into Jeffco Sheriff Biometrics program. Just a reminder, Leslie, Michael Miller have conflicts of interest. I don't see Michael Prang, Barb, Dr. Story, or Kristen in this meeting. So that is just a reminder. This includes asking questions that's not permitted. So if you feel like you need to step out, please just let us know. That way we can call you back in. So this project will implement a biometric monitoring system to detect medical emergencies among individuals in custody, particularly those at high risk of overdose. The system will utilize wearable technology to continuously monitor vital signs. And they don't have a whole lot of insights. The first question in the R&R asked about the percentage of inmates who agree to wear devices. They said 1% of eligible inmates refuse to wear devices. Similarly, Broomfield Police Department said that refusals are rare, if not non-existent. And then the vendor also said that refusals were rare. They do welcome the opportunity to collaborate with GROC on the development of thoughtful policies that guide the responsible and transparent use of biometric monitoring. The second question asked for data, and as Rosie shared from the SEBMIN group, this is still a pretty new technology. So overall efficacy is still, while promising, is still pretty new. So they said that they have an average population of 700 to 800 inmates. Broomfield's data suggests a rate of approximately 21 confirmed biometric alert related stays per 1,000 inmates. And they're actually increasing, Douglas County is increasing their program by 50% because they've had so much success with it. Then they talked about their system for doing intake screenings and schedule vital sign checks by medical staff every 8 hours, their MAT program, and regular walkthroughs by deputies. Between 2022 and 2024, they did experience 5 in-custody deaths directly linked to overdose or withdrawal complications. And they had 3 more in-custody deaths that involved medical incidents, while not directly tied to substance use, involved some individuals with documented histories of substance abuse, and that may have compromised their overall health. And then they reiterated stats in the application. Between 2023 and 2024, they deployed 77 separate incidences of Narcan with a total of 130 doses administered. The vast majority of these incidents involved individuals still on their 10-day substance use protocol, which is the target population for biometric monitoring. They described financial stability. They will explore the option of providing a matching grant contingent on available county resources for the final award. The congressional funding would only be for 2 years, and they would want to braid that into whatever GROC award was available. Their current approach is dependent on how startup funding is defined in the context of the GROC investment. If the GROC award covers the full first-year cost of the program, including licensing, that's $325,832, then they would move forward with implementation, pursue internal external funding options for sustainability in years 2 and beyond. However, if the GROC startup contribution does not include first-year licensing costs and only covers equipment, they would likely not proceed with implementation unless another funding source was identified. Then they describe their intake period. It's very thorough. Again, I'm not going to read that to you because that was already here. And then I will yield the floor for an 8-minute group discussion.
Can you share, I should know this, I'm embarrassed I don't have this on my head. How much did we allocate to harm reduction in total? And we're putting, this is harm reduction category, right?
Yes. 1,000,000 $544,212.71. I also want to point out that unlike typical funding mechanisms and budgets, we can move money. We just need to file an amendment. So if we decide we want to increase harm reduction to 2 million, and maybe, like I said, we didn't have any applications advanced to group discussion and planning and coordination, which we allocated 1.3 million to, we have that option to do that.
Hi, Chelsea. I have a question. Would the sheriff's office be purchasing the devices or leasing the devices or something else? Or do they have them already?
No, they would purchase the devices, and then they would also purchase, all of the devices need an annual licensing fee.
Hi. Thank you.
I'll share what I was hoping to see was some optimism or some modeling around labor savings in the jail as how this program is going to be sustainable. Like it's going to generate, if we can make the capital investment, it's going to generate labor savings enough to cover the cost over the long run. It'll be a high value investment. I'm a little bit worried about spending a third of our harm reduction allocation in a facility that, for overdose deaths, every overdose death is a tragedy. And we had 190 across Jefferson County. And so are we going to take a third of what we said we wanted to put towards harm reduction to save lives and invest it to what's address roughly 2% of the overdose deaths that are occurring in the county?
So they did cushion 100, they cushioned 20. So they have a proven need for 70 to 80. So that would be item number 2 in the R&R. Oh wait. I know it's in the R&R, where, here it is, right here. So it's on the 4th page. At any given time, approximately 80 of the 700 to 80 inmates housed are on an active substance use protocol. They are requesting 100 devices to support the baseline with a cushion of 20 devices to accommodate natural population fluctuations, temporary loss due to repair or recharge, and medical-based exceptions that may warrant biometric monitoring beyond the standard protocol window. So the budget for the 500,000 is based on 100. The committee can start with 50 monitors. They did outline just 50 monitors in their budget template. So that is an option to get it started. So in the budget work plan, they give you those numbers. So that is something that we can have ready for June 23rd. And again, just because you advance it to June 23rd does not mean that you are committed to funding it on June 23rd.
Chelsea, would the requested amount cover, how many years of licensing costs would that cover?
1 year.
Okay. You have the breakdown of the budget where it shows what would the upfront investment cost would be increased.
I think that would be the whole amount, the 537. So it's
Yeah.
$187,000, $187,500 per year just for the licensing.
Okay. What would then be, what would happen in year two? Or is the sheriff requesting year two licensure fees of 187,000 from GROC? And if they're not requesting it, what would they do with these devices in year two? Would they sort of commitment on their part to continue to use them?
So they are requesting licensing in year two.
And that's already part of the 500?
Yes.
Okay.
But no, this application states that if approved, they will apply again for funding in year 3.
Everybody said that they would apply for funding in year 3. And it will most likely be this number that they apply for.
Monarch is not going to request money in year 3 if we make a capital investment. But anyway,
Most
of
the other applicants are, though.
I expressed sort of a concern and a perspective, but I don't think, to me, that's not a big enough concern that I would prevent the larger body from discussing this and making a decision. So I'm a vote to advance this. I'd love to hear from some others. Last time we made a motion and some people voted no, and I didn't know why. And I'd love to hear from you now if you intend to vote against a motion to advance it.
Is there a second motion to advance?
Yeah, I'll go ahead and make the motion to advance this.
Oh, I'm sorry. I thought you already did. So we don't have a second motion to advance. So are we motioning not to advance? We're done with this application. We're not going to see it again. It's not going to come up on June 23rd.
I think if there is no second, then this body, someone needs to make a motion not to advance it. So.
And I'm looking at Dr. Ryan, Elisa, Sandy, and Bud.
What are you looking at me for? I'll second it, and then we can let the chips fall where they may.
Okay, so we'll vote by opposition. Elisa, Sandy, Bud. Are you guys anyone in opposition?
I just want to indicate for the recording that Sandy said she would also second via text message to Commissioner Dahlkemper.
She also texted me that around the same time. Thank you, Sandy.
All right, so it looks like we will be. Oh,
I'm so sorry, and I know I'm not supposed to weigh in on this, but there's another text that Sandy also sent. May I read that? Or
Yeah.
That's okay?
Yeah.
Okay. Sandy said, let me just make sure this is about okay, I was okay with the partial dollar option. I'm concerned about depleting our 11 million since these are our first 3 requests. I guess, so just an overall comment, Sandy, I hope I'm conveying this correctly related to the proposals that we are reviewing, it sounds like. And I just let her know. I also that was also in response to letting Sandy know that we move Monarch Housing forward with Bud's new suggestion that The other idea of buying the house is still on the table, but we have 2 ideas now, and that we're on to biometrics. So thank you, and I apologize. Thanks. I just wanted to make sure everyone had that information.
Yeah, and again, I don't want you guys to be hesitant about advancing an application for the budget yet. Allow Amber and I to take all the feedback during group discussions and come up with some really creative solutions to the applications that do make it to finalists, to see how we can get as much funded as possible. So I wouldn't stress too much about it. Continue to give us these ideas about partial funding, about alternative conditional funding. That way Amber can work her magic in the spreadsheet. All right, so we will advance Jeffco Biometrics to June 23rd as well. And yes, let's see if I can only request to unmute her. I can't actually like unmute her. We are gonna move in to Jeffco Public Health. Again, Leslie and Michael Miller have conflicts of interest, so we're going to ask that you not speak. Bud also has a conflict of interest on this one, so we're going to ask him not to speak. So the Jeffco Public Health, as a reminder, I'm sorry, I did not fill this in, is seeking to establish a locally led harm reduction program that addresses the needs of people who use drugs in Jefferson, Clear Creek, and Gilpin counties. So all 3 counties that make up Region 10. It will focus on community engagement, mobile outreach, workforce development, and they have a very long R&R. So the first part of the R&R requested that they provide more insight into the types of partnerships applicable, and this should include why they're needed and how they support the goals. So there was a pretty table that I hope everyone read and looked through. We asked them to clarify the specific plan to reach the target population, specifically how peer support will improve participant navigation, and specifically how the program will provide training for law enforcement, healthcare professionals, social service agencies. The target population is to reach the target population. Points West will deploy certified peer family support specialists as part of a mobile harm reduction outreach team. The team will conduct weekly street-based outreach in each county with outreach frequency and location adapted based on findings from community needs assessments and regular ongoing stakeholder consultation. Peers serve as trusted navigators, drawing on lived experience, their peer support training, and strong working knowledge of regional resources to help participants access housing, healthcare, and treatment options. Where local resources or services are scarce, peers will support participants to access services through regional resources, including helping obtain Medicaid transportation, connecting with telehealth-enabled services, and referring to public health nurse programs for treatment providers with intake capacity. Research shows peer-led navigation significantly increases engagement and reduces drop-off between referral and care. To improve coordination across systems, the program delivers training to law enforcement, healthcare, social service agencies. Training includes the cycle of drug-related stigma, an award-winning curriculum selected as a core workshop at the 2024 National Public Health Conference. Training is tailored to each audience, for example, and then they provide that information. Number 3, provide a comparison chart of services across the 3 counties. We appreciate the reviews committee focus on avoiding duplication. The application does not suggest an absence of peer or harm reduction services in Clear Creek, Gilpin, or Jefferson, but rather highlights a gap in harm reduction centered peer support integrated with mobile syringe access and FTIR services. Our proposal complements existing efforts with Advocates for Recovery, JCMH, and Clear Creek County Public Health with an additional narrative. Please provide clarity about the project's mobile and street team outreach plans. That was given. Then number 5, clarify how you intend to equitably divide time for your project. This would come out of the needs assessment, but then they did give a sample outreach schedule that is intended to be illustrative only. The sample frameworks reflects the commitment to allocating at least 1 dedicated service day per week in each county, while preserving the ability to respond to emergent needs, coordinate care, and participate in joint events or rapid response efforts. Number 7, your application did not include letters of acknowledgement, which raises concerns about community-placed programming. Please describe specifically how you will collaborate with Clear Creek and Gilpin County Public Health offices. While formal letters of acknowledgement were not included in the initial application, Points West and Jefferson County Public Health have already initiated engagement with both public health offices and are committed to a sustained, equity-centered partnership approach as we expand services in this area. Specifically, we will collaborate using the following strategies: joint planning meetings, coordination and oversight, formal partnerships agreement that includes memorandums of understanding or letters of commitment with each county, prioritizing cross-agency collaboration, co-hosted outreach and public health events, integration with existing local infrastructure, ongoing feedback, and community-informed adjustments. Number 8, please elaborate on your plan for sustainability. And then we were given a budget breakdown that showed the whole $2 million for the cost of the program. Again, they're asking for roughly 50% of the total cost of the program. Covering the difference through their public health and external braided funds already secured or in the process of renewal. Provide a revised detailed table of the project's timeline with specific measurable milestones or deliverables. Please elaborate on the new technology. The FTIR is a portable device that allows staff to identify the context of drugs by analyzing a small sample. It works with an infrared light that's pointed at the substances, and each compound has a unique fingerprint for how it absorbs the light. Then they give you a plain language summary of what happens. Once they detect what's in there, they provide naloxone, counseling, wound care kit, MOUD referral, just depending on what is in the substance. They have preliminary data from using this with current Jefferson County folks who do report using more cautiously or not at all, some even throwing away their drugs once they find out what's in it and what the risk is. And then I will yield the floor, so I'll give you 1 extra minute for discussion.
So hi everyone, it's Elisa. I'm just giving my opinion here. I don't know if that technology really makes a difference. As I think many on this call know, the entire drug has to be tested with either technology, test strips or infrared. It has to, I think it has to be diluted and then re-dried or whatever to be able to use it. I'm just not sure that the need is really there for this new technology.
Not with this technology. You don't have to, you do have to test the whole substance, but it tests the whole substance with an infrared light. And so you don't have to go through the same process that you do with test strips, where you do have to test all of the substances in water, then redehydrate your drug. So it's extremely more efficient.
Okay.
It doesn't waste the drugs, and it happens in real time.
All right, so thank you for correcting me on that, Dr. Chelsea. The other concern that I have is that we do have some harm reduction in Gilpin County. We definitely have advocates for recovery doing peer support. We have medically assisted treatment through Jefferson Center. So none of these things were mentioned in the proposal that it seemed that they didn't realize we had these services here in Gilpin. And I also know they have harm reduction services in Clear Creek. Maybe not as extensive. Dr. Ryan could speak more to that, but this sounds to me like it's really focused on Jeffco and not on Gilpin and Clear Creek. I'm not saying that Jeffco doesn't need this program, but it's really an extension of a program they already have that's already serving that community. And I'm just not, at least from a Gilpin perspective, seeing how it's going to be a value added for Gilpin County at all. Thank you.
So this was actually addressed in the R&R item number 3. And 3, 4, 5, and 7, where they addressed a lot of those concerns of how they would divide up time, physically going into the community. Advocates for Recovery is a recovery peer support services, and this program is talking about harm reduction peer support services. So Advocates for Recovery is people who do not use drugs or drink alcohol. This program is support for people who are using drugs and alcohol.
Right. And that's what we have the Jefferson Center program for as well. The mobile mat, which has been trying for many, many years and has not made enough connections. So I don't see the need in Gilpin County still.
I'll share my perspective on the application, speaking broadly, not on. I kind of want to defer to Tim, Dr. Ryan, on if this advances and we get to contracting, the kind of interest we have in Clear Creek County. It does. I will share it. What they're talking about to me is clearly a unique service that is not offered that could benefit people wherever it's delivered. That includes Jefferson County. I think the vast majority of these dollars would be spent in Jefferson County, which makes sense because that's where the vast majority of people are. I think it would be, Elisa, I hear you saying you don't know if you see value to Gilpin County of approving this application. And I view our role here on the GROC as really trying to think about the whole region. And the people in the metro area that have needs as well. And so I think it would be a mistake not to advance this application and give it more consideration. I think there's a lot of questions, like budget related questions, that Dr. Shore is asking us to sort of not consider here, right, as to whether we would partially fund or what. But I would sort of implore us to move this forward.
This might also be an appropriate on June 23rd, a conditional fund, where we give them this ceiling, they conduct the needs assessment in Gilpin and Clear Creek and bring that information back and let us know if they are going to actually meet this dollar amount by serving Gilpin, if there really is no need in Gilpin and the dollar amount can be reduced. That is a potential option on June 23rd.
And so, Lisa, maybe I'll just ask you a question. If this application did not include Gilpin because you do not see value of these services in Gilpin County or a need for them, would your head go towards denying the application or partial funding and not funding whatever the cost associated with being in Gilpin would be?
So thank you, George. If Jefferson County and Clear Creek County clearly see the need for this, I would not, of course, stand in the way. Like you said, this is a regional council and applications can benefit any one or all of the counties. I just work directly with Jefferson Center, and I have for years on their mobile mat program, and they have struggled to connect with any current drug users using their mobile services. And they've been trying this in various locations and various tactics for the 3.5 years I've been here, and they haven't connected with people. Gilpin.
I think we're hearing a similar thing associated with medication assisted treatment. This is where it's kind of hard when the applicant can't speak, but in my imagination, this might be a little bit less sitting in a parking lot and a little bit more, finding people and talking to them.
And then Sandy texted in, I wouldn't say there is no value to Gilpin. What can be done with partial funding to pilot in Jeffco first? Yeah, so that would all be things that I can work with the applicant to get a revised budget for June 23rd.
So my concern is sort of along the lines of Elisa's, in the sense that if this mobile unit comes at some scheduled service delivery times, whatever that might be, once a week, once a month, how long are they going to come and sit in the parking lot or drive around before they stop coming, right? The MAT van is probably going to stop coming at some time in the future, to Elisa's point of lack of participants. So I'm just thinking long term. The harm reduction program, which I visited over a year ago down at Jeffco, and had lots of conversations with many people who may or may not still be there. I don't know. It's a great program and it should continue. They're doing great work. They serve lots and lots and lots and lots and lots and lots of people who have direct access to their services. But I don't know how effective and how long you're going to drive up here to deliver services. We looked into a needle exchange after having a conversation with Jeffco and trying to have a vending machine, just as an example. And without a single dollar in harm reduction here in Clear Creek, we've managed to piece together a handful of different things that we offer. But the one thing about the vending machine was, it, as per Jeffco, was it requires staff, and it requires staff to be here regularly to have those conversations with folks who want to do a needle exchange. Someone has to be here to facilitate that. It's not a simple process. It isn't just press the button on the vending machine. If that were the case, every kid in this county would be pulling every harm reduction thing out of that thing quicker than we could fill it. So we opted to not have that. One, because there's lots of logistical problems. We also don't have any staff to assist with that program and that sort of notion. As important as I think it is, as important as I think every aspect of harm reduction is. So I'm not against funding this. I think Jeffco should continue to do the great work they're doing in harm reduction. But this is about Jeffco. It isn't. I haven't been contacted by anyone from Jeffco around this grant application or anything about it. So I think we should move forward. I don't know if that's a motion, move forward to fund this, but it should reflect the reality of who it's going to serve. And if they can manage to come up here and see and try things, great. But how long that's going to be sustained, I have no idea. I would guess not terribly long.
So I see that. George, go ahead.
Yeah, I'll just kind of share as I think about this application. My hope is that if we do move forward to funding before the contract is signed, that contract can be reflective of the conversation between the counties, and that we could write into the contract answers to questions like, how long would you provide these services, and at what thresholds would you decide to stop? But the other thing that I want to share here is the R&R raised a little bit of a flag for me in that they're facing a funding cliff for their existing program, and they're trying to expand it at the same time. And it makes me a little bit nervous to spend this much money over a couple of years. It makes me wonder what happens in years 3, 4, 5. So I have an open question, if this does advance, which I support, around, I'd like to see a plan that results in us having some confidence that these services will exist over a longer period of time. With that, I'll make a motion to advance the application.
Well, I think you're the second.
Oh, somebody made the motion, I'll second.
I thought Tim made the motion. Dr. Ryan made the motion.
Tim, did you make a motion?
I did, George. I don't think you were listening.
So what I can do, if I'm gathering all of this information correctly, is I will work with the applicant to get a budget just to do the needs assessment. And then we can do like a conditional fund on the needs assessment. And so we do the needs assessment and we come back to the table to see really what those needs are in Gilpin and Clear Creek and if they do add up to this budget.
And Chelsea, I had one more thought. I talked to my staff this morning about this very thing, and one of the things that they had applied for in our harm reduction grant was the ability to do STI testing and treatment. Is that included in this particular grant? I haven't seen the grant, haven't read the grant directly. So is that available, and would that be available in the mobile unit? Because right now we have the ability to do it, but our funding is going away too. From the STI testing perspective? Does anyone know who reviewed the grant initially?
I reviewed the grant and I don't believe there's anything mentioned about STI testing at all. This is Elisa. Thanks.
Yeah, they don't mention it specifically in the grant. I feel like I saw this in a budget line item.
I guess I would want to know if that's part of their current harm reduction program, Tim. I didn't specify it in the grant at all.
It is part of their current harm reduction program. It is an allowable expense under Exhibit E. It's tied under harm reduction. I'm looking at their line item budget right now. It might be embedded in a line item budget because it talks about safer use equipment broadly. So I can find out more specifically and have that in the conditional budget for June 23rd.
And the idea around STI testing for harm reduction is that you can sort of emphasize to people that they might not want to exchange syringes because they have an STI.
Yeah, and that's the same like with HIV and Hep C, is that if you are, even if you're just snorting cocaine and you share the bill used for that or the straw used for that, there's higher risk. So if you know that you have these things, then you know not to share with others.
Well, and never mind unprotected sex.
Yeah.
The elephant in the room, right? Like,
all right, so we will vote by opposition. At this point, it's really just Sandy and Elisa. If you are opposed to this advancing into the June 23rd budget discussion, I will come back with some conditional budgets. Again, just to give the committee options and partial and conditional funding.
Chelsea, I would, while we're waiting for people to raise their hands in case they oppose, I would love one of those options to be a combination of like sustain and evaluate, right? What does it take to sustain today's services with the cliff that they're facing and fund an evaluation?
Is that not
asking for an answer now?
Okay, I was gonna say, is that not answered in the R&R, that last question? Please elaborate on your plan for sustainability after a potential initial award. So items 8 and 9. Or it's just 8. Yeah, item 8, George, in the R&R. All right, so with that, all 3 applications have advanced to June 23rd. I'm going to give you about 15 minutes of your time left. Our next meeting is going to be on May 12th. This is hybrid in person at the Jefferson County Courts and Admin Building, as well as on WebEx. I'm almost done printing your 2 other booklets. So I will hand those out. If Sandy and George do not intend to be there in person, just let me know. I can make a trip up to Gilpin. That way you guys have your packets. But I will work on these revised budgets, and please let me know if you have any questions, again, about the landscape, about topics, different motions that you can make on June 23rd. Otherwise, thank you all for a great meeting. I will see you next Monday.
Thanks, Chelsea. Thanks, everyone.
Bye.
Thank you. Bye-bye.